Well, good morning and welcome to the Tampa Bay Business Profile on Money Talk 1010, and I am very excited. We try to profile someone in the Bay Area, and this morning we are going to be profiling from K3NowMD.com, and our guest this morning is Dr. Robert Kowalski. Good morning, doctor. How are you?
Good morning. How are you doing?
I am doing wonderful. Where are you located right now? Are you in the Tampa Bay area somewhere?
Our main practice currently is at 603 South Boulevard in South Tampa.
And that main practice is K3NowMD.com. Am I correct with that?
Correct.
Okay, and if you could tell me a little bit about your history and your background before we have to get into the meat of everything, and I know we only have a short period of time with you and a lot of information to cover. Give us a little bit of your background, and then we'll go right into why you're here this morning.
Sure. I'm a traditionally trained neurosurgeon. I trained at the Cleveland Clinic Foundation and have a clinical practice in neurosurgery, both in Tampa and the Clearwater area. But about 10 years ago, through my own sort of desire to increase my quality of life, I started looking at wellness and educating myself and started as a patient 10 years ago. And about after 2 years of being a patient in a wellness practice, sort of dawned on me that I could probably understand this stuff better and should know it better for my own benefit. And in fact, a lot of wellness has to do with the endocrine system, which is ultimately under the control of the brain, the pituitary gland in particular. And that really sort of catapulted my self-education. And over the years, between self-education and then joining the American Academy of Anti-Aging and Medicine, which is sort of our national organization, and becoming a fellow with that, started getting more and working as a consultant in this area. And then over the years came in contact with quality people that just sort of formed then the practice as it exists now, which started about 2 years ago.
Well, I'm going to translate a little bit of this. If someone just tuned in and they want to know what we're talking about, we're going to focus on hormone treatment for men and women. And I got to tell you, I was pretty dumb in this subject. I thought hormone treatment was only for men. And come to find out, that is definitely not the case.
No, about 50% of our patients are female. If you just listen to the radio and TV, you might think that, your endocrine system, which encompasses both in women the ovaries and in male the testes, but also includes the thyroid gland, the adrenal gland. So it's controls many different organ systems in the body. Testosterone replacement in men is certainly a very common, sort of easily correctable problem and quite frankly, a high profit area. So that's why you see so many of these practices opening up. But they are, basically only cherry picking the sort of easiest and most high profit. Even in men that have low testosterone, they often have other issues with the endocrine system. And it's sort of a, wear and tear phenomenon, much like our musculoskeletal system experiences wear and tear, and we have sore hips and knees as we get older. Our endocrine system also becomes less efficient. And again, if you have testosterone issues, you probably have other issues. So trying to go to one of these places that only focuses on one thing, you're probably doing yourself a disservice. And obviously, as we pointed out, the other half of the population, the female population, is sort of left out in the cold, and they certainly have some of the similar issues. Women also have testosterone, also need testosterone. It's about 1/10 of what men have, but it's still necessary for them. Just like men also have estrogen that has to be managed. And in fact, when men take testosterone, part of the testosterone is aromatized or converted to estrogen, and that has to be controlled along with your testosterone level.
And so you're not a testosterone house. You are more than that. Not only are you going to administer the medication, you're going to work with the patient and continually keep things going as far as monitoring and telling them what to do. And a big surprise to me was that I thought testosterone just had to do something with your physical ability with the opposite sex, but that's not true. It's moodiness, sleep issues, fatigue, lack of muscle.
Yeah, really. I mean, testosterone, they've just recently found that we actually have testosterone receptors, both in men and women, on almost every cell type in the body. And so we're really just scratching the surface. I mean, the obvious ones are testosterone helps you build lean muscle mass. It helps avoid the accumulation of abdominal fat. It has roles in moodiness and alertness. And then obviously, there's the more obvious, sexual effects. But again, that's one of the things sort of interesting in this whole area. What interested me in neurosurgery was we probably only know about 10% of what there is to know about the brain and central nervous system. It's the same way. I think we're just scratching the surface with longevity and wellness. meaning that I think, as we get more into it, we're really going to begin to start pushing the bounds. There's a thought that the first person that's going to live past 150 has already been born. And again, there's no physiologic reason why we sort of have to accept, current longevity in the high 70s. And as we learn more and more about what causes us to age, and then if we can reverse those processes, sort of the sky's the limit, literally. And not only do we want to increase longevity, but also quality of life is obviously just as important.
So this could be the fountain of youth, for lack of a better term on that.
Well, quite literally, yes. And there's a thought. One thought was, the reason we age is because our endocrine system, among other parts of our body, starts to decline. Another thought is we age because our endocrine system starts to decline. And so it's sort of a chicken versus egg debate, but obviously understanding that's key to unlocking, longer longevity and again, most importantly, the quality of life in doing so. Some of testosterone is sort of a good example. I mean, the conventional wisdom is that if you went to the lab and had your testosterone checked, they would say a reference range would be 300 to 1200. Well, 300 would probably be an acceptable level if you were 85, but if you're a male in your 40s or 50s and had a testosterone level of 350, you're probably either miserable or don't realize how much better you could feel. And if you went to, a traditional medicine doctor, they're going to tell you, hey, you're in the reference range, you're okay, I don't know what your problem is. But really, that's a lack of understanding. And this is the problem. Traditional medicine tends to be reactive. And so we're taught to look for tumors of the endocrine system, and we're not really taught how to manage the endocrine system from a wellness standpoint and to make people feel better. And so by simply using bioidentical hormones and replacing a male's testosterone level back to what it should be in about when they're 25, about 900 or so, you're going to feel much better and get all those benefits we talked about: increased lean muscle mass, abdominal fat, better sexual performance. And there's really one small negative of testosterone replacement, and that is in about a third of men, it's going to increase their red blood cell production. And you need red blood cells. Red blood cells are what carry oxygen to your body. You can have too much of a good thing. And so if your hematocrit, the measure of your red blood cell level, climbs above 50, that's simply remedied by just donating blood a couple times a year. And if you're somebody who, for one reason or another, can't donate blood, you can just do what they call a therapeutic draw, where they would just take your blood and then discard it. But, in medicine, we always are talking about the risks versus the benefits. And so, again, those benefits that we enumerated before, and really only one, rare side effect, it's sort of a no-brainer for testosterone replacement. But it's the traditional medicine has sort of avoided the subject and has sort of created a vacuum. And that's what you see going on today with all these other centers open up. They're trying to fill that vacuum. Unfortunately, when that happens, you have some people who are doing it wrong, some people who are doing it in a way trying to maximize profit, and then obviously, luckily, there are some people out there doing it correctly and doing it for the patient's benefit. Obviously, I think we fall in that latter category.
Well, Dr. Kowalski from K3NowMD.com, we got about 2 minutes left, and I got to jump in there and tell you real quick that I've just had my blood work done, and anybody that'll come in and see you at K3NowMD.com, they're going to get a blood work done. They're going to find out what their levels are. My level is 128, and finding out that is definitely not good. And you were talking just under 300, I'm in problems, and now I know that why I sit around, I feel lethargic, I don't want to do anything, my sex drive is down, and it's definitely that I probably need to come and see you. And now, this is a shot or is this a gel?
Well, there's different modalities for testosterone. Because in men, typically, they need a lot of testosterone. Typically, the best vehicle for that is an injection.
Okay.
There are testosterone gels. The amount of testosterone you get from those is relatively small, so if you need a lot, it's probably not going to work. When you take the gels, another side effect of the gels is they have a lot of conversion to something called DHT, or dihydrotestosterone, which tends to accelerate male pattern baldness. So typically that's not a desirable side effect for most men. So most men are on injections. Women who need lower levels of progesterone, estrogen, and testosterone, typically they can get their medications in a cream form.
Well, we thank you so much. And I knew the visit was going to be short. We just scratched the surface. We will be back again. You've been listening to Dr. Robert Kowalski from K3NowMD.com. And we'll be back again shortly on Money Talk 1010.